Hello everyone, and welcome to day 2 of week 10. This is actually going to be our last actual class. Next week we will move into practical finals, so this is your last class of this quarter. Crazy to think that it is already here, but it will be a good one, that I can promise. So if you remember this week, I said that we were focusing on the topic of phlebotomy, and that was going to be chapters 44 and 47. Now, in that day 1 video that I put up this week, I did go over chapter 47, which was kind of that introduction into phlebotomy, which talked about, what phlebotomy is, what your role is during that procedure, the different types of procedures, the different equipment that you will use, and where that phlebotomy procedure is done. So today, in the day 2 video, I'm going to be talking about chapter 44. And chapter 44 is going to deal with the clinical laboratories. So when we start talking about clinical labs, we're talking about the actual lab tests that are drawn and why those are so important for you to know about. So clinical labs are helpful for not only the physician, but also for the patient. What they do is they help to provide a way to screen for certain diseases, a way to confirm a condition suspected by the physician, or to maybe rule out a condition. So those first three are all they seem to kind of go pretty well together. They are important for the provider, especially if maybe the patient has a family history. We can help show them if they've got those genetic factors for it, if they've got the gene for it. Maybe they want to know if they're going to have anything passed down to their children. Maybe if they've got some genetic disorders that could be passed on. We can also, if the doctor suspects that a patient might have a disease, we can confirm or deny that for the patient. And all of those are very helpful because it gives the patient answers to questions that they maybe have. Clinical labs are also important because it helps us to establish a baseline before we administer any medications to a patient. It also helps us to monitor their effectiveness of a medication or a treatment plan. And then it helps us to assess or watch the progress of a disease. So those last three go together as well, because before we can set up a treatment plan, before we can figure out how to start a patient on medicine, we need to know where we're starting. So the example I like to use is think about patients who have diabetes. They're going to be individuals who, before we start giving them insulin or metformin or glipizide or some sort of medication, we need to have a baseline of where we're starting. We need to know what their glucose is, what we want them to be at, and go from there. Those help to set up that treatment plan. Then once they're on that plan, we need to make sure that medication's still working. And if it's still working, we need to know how their disease is progressing. When we talk about labs, they're typically falling into two categories. They're either qualitative or quantitative. A qualitative test is something that is going to be a result that is either positive or negative. Those are the only two options for their result. The best advice and the best example I can give is something like a pregnancy test. When you take a pregnancy test, it's looking for one specific substance, the HCG hormone, and it will tell you, yes, you are pregnant, or no, you are not. Yes or no, positive or negative. Those are the only results that you'll receive with that qualitative test. Now, on the flip side of that, a quantitative test is one that will give you a numerical value as a result. This will also give you a range that will be normal and a range that will be abnormal. So an example of this would be like a glucose test or maybe a CBC. Those will all give you a numerical value, and it will also give you a range of what is normal and what is abnormal. Now that we have talked about labs themselves and their importance, we also need to talk about some of the regulations that are important for labs. And when I say this, I mean the actual physical building of a lab. The first important amendment that we need to discuss and understand is what we call CLIA, the Clinical Laboratory Improvement Amendment of 1988. This was created in a way to protect patients by creating safety policies and procedures. The amendment addresses issues of quality control, quality assurance, record keeping, and qualifications of the personnel performing certain lab tests. CLIA also is established to help set standards to ensure test accuracy, reliability of the tests, and the timeliness of the results, regardless of the type of test that has been completed. The regulations for CLIA also consist of 4 sets of rules. The 4 sets of rules are laboratory standards, user and application fees, procedures for enforcement, and approval of the accreditation program. All labs, regardless of what kind they are, big, small, private, public, they all are required to register and be accredited through CLIA. If the company and the lab does not get accredited through the CLIA, what will happen is they will be fined. They could potentially be sued for malpractice. They can also be shut down, and if they were to try to open up again, it would be very difficult for them to get approval. Regulations and breaking those regulations with CLIA are very similar to that of OSHA. Now, we talked about OSHA at length for a few weeks, starting back in Module 4 when we talked about medical law and ethics. So because we've spent such a great deal of time talking about those in the past, I am not going to talk about OSHA in this video, but if you would like some more information on OSHA, I would suggest going back to Module 4 and revisiting those chapters on medical law and ethics. Okay, so now that we understand the amendments, we understand the regulations, we understand what clinical labs are, we need to talk about some of the fundamentals, and those are your quality assurance and your quality control. Now, as a medical assistant with quality assurance, you are responsible for carrying out the procedures that involve planning and systematic activities to ensure that the requirements are met and the results are accurate according to the quality assurance standards. When we talk about quality assurance, it should and will consist of all of the following things. Quality control. It will consist of orientation of its personnel, making sure that that is up to date and done regularly, at least once a year. It's going to have the documentation of the controls in a quality control log. It will have maintenance checks on all equipment and instruments. This is typically done about every 3 to 6 months because as machines get used, things get shifted, and we want to make sure that they are up to date at all times. You will be required under quality assurance to have calibration checks of your instruments. You'll have to do temperature checks on all of your refrigerations, on refrigerated items, your certain quality control samples, control solutions, test kits, things like that. You will also have to check the expiration dates on your test kits and your reagents. Remember, if something is expired, you cannot use it. It will not give appropriate results. And the last thing that your quality assurance will do is it will provide proficiency testing. And what that means is that the companies will send you out a specific test strip or a cassette or a cartridge that will have a predetermined value on it, and you will be responsible for making sure that your machine receives that predetermined value. If it doesn't, you have to have them come out and recheck the machine for maintenance. Now, quality assurance also develops what we call a reference value, or your normal ranges. They are the ones that are responsible for doing all of that for every different test and every different test kit. So maybe you have 3 different types of mono test kits. Each one will have a different value based off of what that company says is their normal or reference value. Now, when we talk about quality control, this is focused on the physical proof that the results you receive are accurate. This is done by routinely performing mock testings, and those mock testings are done either with calibrations or quality control solutions. Typically, you want to run a quality control on every instrument or every test cassette that you could potentially use every single day. That will make sure that you are the most up to date and things are running the way that they should be. Now, a calibration for your mock testing is, like I kind of talked about earlier, it's a specific or a specifically prepared test strip or cartridge that has a pre-designed and predetermined value to it. So when you run that sample with that calibration, it should have the same result that it came with. Where a control solution is a chemical that produces the expected results for a test, and it's typically similar to that of your testing specimen. So if you have a quality control for urinalysis testing, the substance that comes, or the solution that comes, is closely related to that of urine. It's not actual urine, but it's close enough. Same thing with certain quality controls when we're doing blood testings. Those samples that come or the chemicals that come are similar to that of the blood that we would run. Not necessarily blood itself, but chemically very close to it. Alright guys, that is all that I have for this week's video for day 2. If you do have any questions or concerns, please make sure that you bring them to class. We will be working more with phlebotomy and getting those skills down before we head into your finals week in week 11. I look forward to seeing all of you on day 2. Have a wonderful week, guys. Bye-bye.